Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Early Ejaculation Disorder. What is early ejaculation disorder? Early ejaculation disorder, meaning is described as premature ejaculation, earlier than he or his partner desires, while having sexual activity. It is also popularly known as premature ejaculation. It could occur before or right after penetration. It is a very ordinary condition, but if it impacts your sexual life or relationship, finding professional medical help must be your priority. Many men say they develop this disorder at a point in life. It is not exactly a point of concern if it does not happen quite often. Here, you will know of its symptoms, causes, treatment options for early ejaculation, and when to seek professional medical help. Common symptoms of early ejaculation. Early ejaculation is characterized as repetitively ejaculating sooner than you or your partner would desire to while having sexual intercourse, often in a minute of vaginal penetration, ending in unsatisfying sexual intercourse. It can influence the person's self-esteem and confidence, trigger psychological stress, and bring in problems in a relationship. It is crucial to comprehend that this situation can occur in any sexual intercourse, which consists of masturbation. When you repetitively observe the following indications and signs of early ejaculation, you may check in with your doctor. Negative self-image. People with this condition can develop a destructive self-image related to their sexual performance. This could happen apart from the sexual circumstances and impact confidence during numerous factors of life. Rapid ejaculation. The first and foremost indication of this sexual disorder is finishing quicker than anticipated during a sexual encounter. This can happen right after vaginal stimulation or even earlier than that, ending in feelings of displeasure and aggravation for both individuals present in the activity. Loss of sexual intimacy. Developing premature ejaculation can give rise to a lack of sexual intimacy. This can also concern the emotional bond in a relationship. Lack of control. Individuals with PE typically flunk to hold control over their ejaculatory reaction. It can take place without decided control and end in difficulties with enduring sexual circumstances. Stress and irritation. Extended PE could result in exasperation and stress, shaping a pessimistic point of tension about the situation that worsens it. This mental weight can impact entire well-being. Performance anxiety. The terror of ejaculating earlier can lead to performance anxiety, making the condition of ejaculating quickly. The anxiety itself can contribute to the development of the condition. Causes of early ejaculation disorder. The causes of premature ejaculation disorder can be both psychological and physiological. Psychological causes can include poor body image, performance anxiety, relationship issues, low self-esteem, stress, depression, and sexual abuse. Physiological causes can include imbalanced hormone quantity, hypersensitivity to the penis, inflammation or infection, and genetics. Various other conditions can also cause early ejaculation directly or indirectly, aggravating or intensifying its development. These conditions consist of erectile dysfunction, neurological problems, long-lasting prostatitis, thyroid disorders, relationship issues, substance abuse. The link between numerous conditions and premature ejaculation can vary among individuals. Aiming for the original cause, either by medical contribution, lifestyle factors, or therapy, can sometimes give rise to the improvement of the condition. Treatment options for early ejaculation. Psychological counseling and therapy. Psychological counseling and therapy can potentially support you to manage early ejaculation by targeting psychological risk factors and assisting you to develop management approaches. These treatment options can involve sex therapy, mindfulness therapy, and couples therapy. Behavioral techniques and exercises. Start-stop method, Kegel exercises, edging. Behavioral techniques and exercises could be efficient in treating early ejaculation by assisting affected people to improve control over their ejaculatory reaction. These techniques can include the start-stop method, the squeezing technique, Kegels, and pelvic floor exercises, at times along with relaxation exercises and open communication with the partner. Best medicine for early discharge break. The most common type of treatment for early ejaculation disorder is medicinal treatment due to its convenient and easy dosing. Your healthcare provider will establish the medication depending on several treatment-affecting factors, such as body weight, age, severity of the condition, other medical conditions, and medicines or treatments for the same. Some of these early ejaculation medicines are break topical numbing agents such as benzocaine, lidocaine, and prilocaine. Break oral medicines like Generic Priligy SSRIs, antidepressants like citalopram, paroxetine, dapaxetine, fluoxetine, or escitalopram. Lifestyle changes to prevent early ejaculation. Break. For anyone questioning how they can prevent early ejaculation naturally, the lifestyle changes listed below can contribute to the prevention of early discharge, along with medical solutions and behavioral techniques. Daily physical exercise. Maintain sleep-wake cycle. Stress management. Avoid consuming alcohol. Quit smoking. Communicate with your partner. Foods to prevent early ejaculation include avocado, watermelon, spinach, walnuts, etc. When to seek help. Break. It is normal to feel nervous about discussing your sexual discomforts with anyone. But, you should put your faith in your healthcare provider because they have gone through related conversations with many people in similar conditions, as it is an ordinary disorder and one that could be handled. Make certain to consult your healthcare provider when this problem begins to affect your sexual life and triggers constant anxiety and stress. It is okay to feel uncomfortable and doubtful about opening up about sex, but remember that the healthcare professionals are not there to belittle you but to unravel your problem. Conclusion. Break. Early ejaculation is a common sexual disorder that many men develop at certain times in their lives. But it is not a critical dysfunction except when it starts impacting your sexual life or connection with your partner. If you ejaculate too early during stimulation, look for medical help, and with its guidance, consider premature ejaculation disorder medications to treat it. FAQs. Why am I ejaculating so early? Break. Early ejaculation can be sourced from a blend of certain psychological and physical aspects, which can include causes such as performance anxiety, sexual trauma, relationship problems, or low self-esteem. How does premature ejaculation feel? Break. Premature ejaculation can develop a series of feelings in both the people experiencing the disorder and their partners. Men could feel guilty, frustrated, ashamed, anxious, and disconnected from their partners. Is early ejaculation a permanent condition? Break. Absolutely no. Early ejaculation is not usually a permanent condition. Though some people experience it quite a few times from their first sexual encounter itself, it is often a treatable problem with several treatment options. Can herbal remedies treat early ejaculation? Break. Although some herbal remedies are traditionally used for the treatment of early ejaculation, there is not sufficient evidence supporting their efficiency. Certain herbs like St. John's wort, Hypericum perforatum, and other traditional Chinese and Ayurvedic medicines exhibit effects in several research studies. However, more study is required. References: rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.